Tremendous backlash. The World Health Organization is walking back comments made yesterday on the spread of COVID-19. In a press briefing on Monday, a WHO official suggested that the spread by the virus by asymptomatic people is very rare. Beth Ward joins us live from her home with the latest, including some of that backlash, Beth, coming from Governor Charlie Baker.
Well, Jordan, in his daily press briefing today, Governor Charlie Baker blasted the WHO for what he called misleading comments. Well, he's not alone. Much criticism coming from around the world and here in Western Mass.
A World Health Organization expert is trying to clear up what she calls a misunderstanding about comments she made Monday, suggesting that people without COVID-19 symptoms rarely transmit the coronavirus. Her remarks quickly came under fire globally and here in the Bay State.
I am enormously skeptical of such a broad generalization about something where there is so much data and information already available that says just the opposite.
Today, that WHO official insists she was referring only to a few studies, not a complete picture.
I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that.
There is concern, however, that the damage may be done and people might think wearing a face covering is no longer necessary.
An assertion that somebody who does not have symptoms would not very readily transmit the virus would be very important information for all of us to understand. But without the requisite data to really be able to show and explain where that assertion is coming from, it could also be extremely irresponsible and dangerous.
Mercy Medical Center Chief Medical Officer says each and every day researchers are learning more about COVID-19. However,
right now, the overwhelming amount of science still shows that individuals who have no symptoms or few symptoms or could be in the period of time without symptoms before they get symptoms can still represent a risk for transmitting the virus.
He tells Western Mass News the overwhelming amount of data says masks and social distancing are still some of the best ways to stop the spread of COVID-19.
As a healthcare provider and as somebody working in hospitals and involved in the public health, I would encourage people to continue to take these precautions, certainly until there would be other evidence to suggest otherwise.
Now, in the meantime, the Centers for Disease Control and Prevention continues to maintain that people should still be wearing those face masks. Reporting live from home, Beth Ward, Western Mass News. Back to you.
All right, Beth, thanks. And for more coverage on the coronavirus emergency as it continues to develop, you can log on to our free streaming Western Mass News app.